Good evening, everyone. I'm going to call to order the regular meeting of the Dunn County Health and Human Services Board for Thursday, August 24th. Let the record show that all of the members are present with the exception of Supervisor Breslin, unless he has joined us online. All right. I will need approval of the meeting minutes from our last meeting, which was July 27th, 2023. They were in your packet.
Could I ask for a small revision?
Absolutely.
So my name is Alexandra Hall instead of Alexander Hall.
You know, I didn't see that. Yes,
Thank you.
absolutely. We will correct that. All right. I need a motion to approve the July 27th minutes as corrected.
I'll move we approve as corrected.
All right. Is a second?
I'll
Dr.
second.
Hall seconds. Any further discussion of the minutes? If not, all in favor, say aye.
Aye.
Aye. Any opposed? Minutes are approved for July 27th. Next meeting date. Boy, this is really hard for me to believe that our next meeting is the end of September, the 28th. Regular schedule, still okay with everybody? All right, moving on. Without objection and in deference to our staff, I would like to move the children's long-term waiver presentation up so that people can get on with their evening and their life. Paula, do you want to make an introduction, please?
I'd like to introduce Casey, who is the behavior health manager and the supervisor of the program, Children's Long-Term Support Waiver. And I know she's got a PowerPoint she's going to share with us.
Welcome, Casey, and thank you.
And you have to turn your mic on too.
And your portable mic too. There you go. I know, it's a lot of stuff here.
Feels like I was in an exercise program. So yes, I'm Casey Pogorelski. I'm one of the behavioral health services managers, and one of the the two programs that I supervise or manage is the Children's Long-Term Support Waiver and the Children's Community Options Program. My husband and I, we also live here in Dunn County, and we have two children, Hazel and Frankie, that attend Menominee High School and middle school. So we are Dunn County through and through. So the main purpose of these programs is to divert children from institutional placements, out-of-home placements, and to keep them safely in their community with their families, with their siblings, as safely as we possibly can. What's super exciting is we have spent $2.1 million worth of services in our community for these children and families through the waiver program. And it's at a cost you can't see. So I will try to move that.
I think they're renting here.
Yeah, they'll minimize that.
Oh, okay.
There you go.
There we go. At a cost to the county of just under $27,000. So a pretty big bang for your buck. With that amount of money being funneled into our community is safer, our community is supported, and really promotes wellness within our family units and family systems. Because what we do know is children that have special needs or differing needs, disabilities, however you want to share that they're at a higher likelihood of abuse and neglect, just because they have such higher needs. And if children that have these types of needs are removed, they're going to need higher cost of care to be able to maintain their needs in an out-of-home placement setting. So who are we serving? Currently, we have 173 children in our program. We have 7 support and service coordinators, or either social workers or caseworkers that manage this caseload. And if you can see, we've had quite a bit of growth over the last 10 years. So 172% growth over the last 10 years. 49 of these children are dually served in another program called Comprehensive Community Services, which is a recovery-based program. And 28 are involved in the child protection or youth justice system. And we currently have 16 children waiting to enroll in our program. And there's no waiting list right now to be screened for eligibility for our program. I didn't skip over it. I moved the slide to the next. So how do you enroll into our program? You have to be between the ages of 0 to your 22nd birthday. You must live in Dunn County, though this is a program that is statewide. All 72 counties in Wisconsin have this program. We just transition children between if they move in and out of our county. You have to meet functional eligibility, which is a screening process that the state has a functional screen where we input the information, and that screen provides eligibility, functional eligibility for 5 different programs. It's the Children's Long-Term Support Waiver, Children's Community Options Program, Community CCS, Comprehensive Community Services, Katie Beckett, which is nurses are only allowed to apply for that program, but the same screen is used. And then the Milwaukee Wraparound, which is only a Milwaukee-based program. Financial eligibility, all children must have Medicaid in order to be in the Children's Long-Term Support Waiver. And if they don't have a Medicaid source, we provide them with a Medicaid source so they can access our services. And then they must need a service. We're not an insurance broker. We're not only an insurance program. We provide service, case management, and support. So not only do children enroll into our program, but we're pretty holistic where I was provided a really great analogy that, you're ready, you want to go on vacation to Spain, you're learning Spanish, you take a class, you start packing, you start researching all the different places that you can visit. You're getting so excited for this trip to Spain, and you get on the plane and you're in the air and the pilot tells you, nope, you got to land in Germany. That's where your vacation is going to be. And so you're still on vacation. And the same can be said for parents, that you're excited about becoming a parent, and then whatever happens at what point in their lives that they find out the most devastating news. And you have to walk them through as a social worker that, will my child ever walk? Will I ever get to hear their voice? Will they ever ride a bike, make a friend, fall in love? And then for parents, you just really start thinking, will I ever get to retire? Do I have to be a caregiver forever? What if I can't be a caregiver anymore? Who's going to take care of my kids? So we're walking families through this constant grief, anticipatory loss all the time. Super heavy, super exciting to do day in and day out. So some of the items, I think it's just interesting to see what we purchase every once in a while. So these are some adaptive aids. We work with children that have physical disabilities, developmental disabilities, and severe emotional disturbances or extreme mental health. For sake of time, I'm going to skip over what I was going to share on this screen because I know I only have about 10 minutes for my presentation. But I would like you to meet Katie. And of course, I did get full consent from Katie's caregivers to use pictures and a little bit about her story. But Katie has been in our program for some time, as you can see, as a little tyke. Children who have access to Medicaid can get one mobility device, and the Stander has wheels, which is identified as a mobility device. So the Stander is really great follow-through therapy. With that weight bearing, keeps her out of the hospital, out of surgeries, to decrease the cost of hospitalization. And so the more weight bearing we can have Katie do, the better for everybody. And so once you put wheels on that, Katie can stand by her friends. She can interact at different parts of her classroom, different parts of her community. And it's a win-win for all. But we also look at the parent. So as you can see, Katie has gotten a lot bigger over the years, and her equipment has gotten much heavier and larger, and we don't want her parents to injure themselves. And so you can see they had a gravel area that they would push Katie through. So on those snowy days, on those muddy days, on those hard days, they're pushing Katie's chair through that. It's unsafe for Katie, and injury can occur to the family. And if Katie has to go to the hospital, or if Katie's parents have to go to the hospital, Katie can't just go to the neighbor. She has high care needs. So we're also trying to avoid injury and keep her in the home and remain safe. So how do we make decisions in this program? Because we get asked a lot for a lot of different things. And everybody has different ideas of what could be helpful in the independence of caregiving and allowing children to have more independence. So we use the deciding together model, and the state has put together this visual for us. We talk with the families about what are their goals of the program, what are their goals for their children, what are the barriers to reaching those goals. We begin to start thinking creatively about how can we meet these goals? What's the most cost-effective option is very important to us, because we know that we're using money that is not ours, so we have to be fiscally responsible. And so we're thinking about a child, and I use fences because this is the easiest one to portray about the most cost-effective option. And so we have a child who has a diagnosis of autism who lives right next to a river. And they're fascinated by the river. Every time they get out of the house, they make it to the river. The parents have found them multiple times, and this is happening when a parent is switching a load of laundry, going to the bathroom, making a meal. So it's not like they're just disregarding their child. So then we start thinking, let's put a fence there so the child can get out of the door, but not out of the space into the river. But we know this child has no gross motor problems. They can move, they can climb, they are strong. So we're going to disregard the chain link fence, and we're going to move to the next cost-effective option, which would be a wooden fence. And then the family is saying, gosh, that wooden fence wouldn't really go with our decor. Can we get the decorative fence? And so what the waiver would say is, we will pay for the wooden fence. We will pay that base cost. If you and your family want to upgrade, go for it. But we will pay for only the most cost-effective option to meet the needs of this child and this family. And then we evaluate, and hopefully that child will not get to the river without supervision. So I rushed through that, but any questions about the waiver program?
Go ahead, Mr. Supervisor Steen.
Yes, I happen to have a granddaughter that's autistic, so how does the IRIS program, is that in this realm, or I guess, is this an option?
So the Children's Long-Term Support Waiver is the waiver for children. The IRIS program is when a child's transitioning to 18,
Yeah,
we
well,
assist.
That's where she's at. So I get it. Okay,
Yep,
thank you.
we assist the children to move into those
Yeah.
programs.
Just a comment if I
Yeah,
could,
please,
Madam
Supervisor
Chairman.
Steen.
I wonder if periodically, Paula, if we couldn't have reporting on some of these things. I think the bang for the buck is very impactful. And I know the reporter for the paper has done a nice job. I'm just thinking, would it be apropos to pick out a few programs and have her talk about those periodically or every quarter?
Yeah, absolutely. I thought that we had been doing that, but
Yeah.
we can pick up the pace, I guess.
Well,
So, I mean, we should.
Yeah.
We should know about these, and this is the best way to
And I
do it,
think-
I think.
I think it's striking, over $2 million worth of service for $27,000. I mean, the average taxpayer has no clue. And I think it would be reassuring to find out that they're doing everything possible to maximize what we can do.
Dr. Hall.
So Supervisor Steen, are you suggesting that we do more of a public education campaign about these programs? Because we are having these sessions here, which I have found really helpful, but are you thinking we need to do a better job kind of touting? More broadly.
Thank you. We've had good luck utilizing the reporter for the Colfax Messenger, Leanne Ralph, who's done a nice write-up on the Veteran Service Office
Mhm.
to raise awareness of that. She's also done a nice write-up on ADRC. And I just think that's good. She digs into her stuff. She knows what she's talking about. And that's the way for the readership, and I don't even know if she puts it into the Glenwood City paper, but that's a different county. But I'm just saying that a lot of people read that paper because she covers the county business very well. And I think it can't hurt. And the more understanding we have of our programs, I think, because a lot of people have no idea what the county can offer or what they do. And the more we can raise that, the appreciation for the county when they get their tax bill, what does it mean? I think that'd be
Yeah,
helpful.
agreed. That's an excellent point, Ms. Winter.
We did, Becky did reach out to her for the Birth to Three program, and then also Menominee Minute picked it up as well. So we did do that, but you're right, we can do more of that, but that was the last one we had to.
Anytime you want me to talk to Leanne,
Okay.
she's more than willing to do it.
Sounds good.
She
Thank you.
covers, all of our county meetings.
Yes,
Yeah.
she does an excellent
Yeah.
job. Dr. Hall.
So I have a question for you, Casey. So, which just discloses my ignorance. So the services that you're providing for families, help me understand, is it mostly equipment or there are other things as well that fall under your purview?
There are many other services that we provide through the children's waiver. The easiest is for children that have physical disabilities to show the public. Those are the easiest. We also provide respite services, daily living skills training, mentoring for children that don't or have exhausted DVR services or Division of Vocational Rehabilitation. We have lots of different services for transition into the workforce, secondary education, discovering career planning, grief and bereavement, just it goes on and on. We have approximately, I want to say 27 to 28 different service codes that we can use in our program.
Thank you. That was what I thought, but I wanted to hear it. Thanks.
Supervisor Hagan, did you have a question?
Yes, please. Thank you. You brought up that this program is statewide through all 72 counties and brought up the number of currently enrolled of 173 children. Since kids can move in and out of counties, you said the program keeps track of that as well. Over the 10-year time period that you listed, do you have a estimation of how many kids like moved into the county and moved out that transition?
I don't have those numbers.
Okay, I think that would kind of boost I would assume, the numbers of total children that this program has helped and serviced throughout the past number of years.
Yes. During the end of 2022, we had a total of 169 children enrolled. However, there were 182 people served in 2022. So there is the accountability to that transition. I just don't have them off the top of my head for you.
That's fine, but thank you. That was a good visualization as to who actually does get helped overall. So thank you.
You're welcome.
Supervisor Steen.
I'm assuming on the picture there, one of the things you did was cement the driveway for that couple, correct?
Yes.
Yeah, that's an example of what they do. I think it's great.
Mhm.
And thank you very much. Appreciate it.
Absolutely.
Other questions? I have one, Casey. Where do people find you? Where are you based largely from referrals from physicians, or how do families locate this service?
I would say that DHS at the state level has really tried hard to make this very quiet program much more known. We have a no wrong door policy. So if somebody's calling the state, we're going to get the referral from them. We've done some outreach at Mayo Clinic, Marshfield Clinic. We want those referrals from medical providers, and most hospital social workers know about our programming. We are at Menominee School Fairs for transition planning and orientation days, just so they know the gambit of behavioral health services that we provide at the county.
Great, thank you. Ms. Winter, did you have a?
I was just going to add the school piece that they've been outreaching to all the schools in Dunn County, not just Menominee, but
All right.
letting them know of the program as well. Yeah.
Perfect, thank you. Supervisor Steen.
Yeah, Miss Rudy, I think that part of your job and part of the school's job is that when you run across these things, you make the information available to the parents, I believe, don't you?
We do, both in IEP meetings or just having conversations with parents. We do work together to help get these referrals moving.
Thank you, Polly.
And though I wasn't asked this question, I will share that we've had pretty long waits for children to enroll, for children to be screened. But because we've been able to expand our workforce, we're seeing that those waits have gone from a year to maybe 2 or 3 months. So it is
Excellent.
really exciting how much movement is happening just with a stronger workforce.
Excellent. That's terrific. Any other questions for Casey? If not, an excellent presentation, and I'm sorry, Paula.
Oh, I just wanted to add, I've spoke before about the Eau Claire County Human Services investigation. And one of the reasons I wanted Casey to share this tonight is some of those purchases, I believe, that were part of that investigation could have come from a program such as this. And some examples that Casey gave of parents being able to pay more for something that they requested or those things. I really wanted you to have a good understanding of why we would be purchasing, how that works in conjunction with that, and just making sure that you're really educated so you can talk to the public, because I know that, there's a lot of people hearing and questioning those things. So you're able to then respond to those questions in the public. So thank you.
Yeah, terrific. Thank you for that insight. Any follow-up questions on that point?
I will just share that coming from the school district kind of perspective, the services and things that have been provided by our collaboration have really supported our families, provided our children and parents with some security and safety. So great service, and I'm very thankful.
Thank you.
That's
Thank you for
excellent to
that.
hear.
Yeah, I'm sure that's reinforcing. Thank you for all your hard work and for an excellent presentation. Appreciate it. Take a cupcake or two. All right, moving on. We are ready for veteran services. Greg, I know you're on active duty. Thank you for joining us.
Yeah, good evening. Thanks for the flexibility, and Cassie, thanks for helping me out with the board pack. I had some limited internet, still do, but thanks for getting that in there. I'll start off, so it's kind of brief and by exception based upon the normal local, state and federal updates, just based upon the timing of the packet being due. What I would identify more on the state level is our association, and there's some stuff in the media. Our state association's president had resigned, and so actually last week I was doing the board pack, I had to hop onto an emergency executive meeting quick. So we've got some leadership double duty, which kind of falls with me as well, with the second vice as well as first vice vice president, as we try to get a few things taken care of. So there business as usual, though, as far as on the state level, when it comes to the benefits for our veterans through the Wisconsin Department of Veterans Affairs. We, as an association, we were hoping for support for an increase in our county Veteran Service Office grant. That didn't go through. There's a minor increase, but certainly anything is appreciated. And then more looking at some other benefits to the Wisconsin property tax credit. There was some pretty good momentum to reduce that for qualification for being 100% disabled down to 70% disabled, but that it's still in progress, but it died on the vine at least during this cycle. But there's support. I do anticipate at some point in the future that there'll be enough support to get that through. On the federal level, things regarding the really increase in contact and claims and inquiries regarding the PACT Act. We've been seeing that, and as well as being reported by my cohorts, which is it is a very good thing to have that. That means that some of the media messages are getting out there from the federal government, and there are some at the state. It was an allowable cost with the supplemental grant that we had received to use that for media and marketing. However, we decided not to because the marketing cost or our share would have been $5,000. I didn't think that would have been a good use of those funds when we are really trying to plus up some extra hours in the office to help. And until we can get everybody served, then I think marketing that would certainly be a benefit. But at this time, thankfully, we don't have to market for business because we have plenty of it. So that's just something that we'll continue to monitor as we go forward. Is there any questions regarding that? I apologize for not having that in written format and
It's
brief.
quite all right, Greg. Questions for Greg about state and federal benefits? If not, go ahead, Greg.
Oh, okay, I'll move into the client served or veterans served report. And again, I place in there the 2022, the full fiscal year, to be able to just have a visual comparison as you review the 2023. And so there was one impact statement that I think is important to note. It's just the many individuals we encounter, and some of them that absolutely are not accessing their benefits as early in their life as we would hope. And this is just kind of a good news story. So probably 5-6 years ago, we had partnered with local VFW to be let's say a consumer or a member of the to be able to do and provide these 50th anniversary lapel pins for Vietnam veterans. And this was just a nice opportunity. And when you're doing some interviewing and just kind of fact finding and collecting, you learn quite a bit about families and individuals. And this was just a nice story to be able to show some honor to the veteran, as well as the story of him in the pain from losing his brother as well. So it's a small token, but it's sometimes the gesture means more than the token. And so we're able to provide that. So hoping, anticipating putting a couple more impact statements next month again. A little bit difficult to capture that over the last couple weeks to put some in there. Is there any questions regarding the Veteran Served report or the impact statement that was provided?
It was a nice story. Any comments or questions about Veterans Served? All right, Greg.
Okay, there's no questions, and I'll move into the budget. And again, our budget, I've for the sake of time this evening, I won't dive too deep into the various cost centers. However, at this point, probably the most important thing that we're managing is because we have additional hours on our attendance hours underneath our salaries and fringe for a part-time person. And so prior to this, I run a report just to ensure that we're on track. Again, those are if not managing those part-time hours, they can come back and create a problem if you're not managing that. So run a report and just reconfigured over the final weeks and working with the employee just to ensure that they're aware of how many hours they have remaining and how many weeks and just right now the anticipated plan on how to use them. So within the budget, that really is the only area that really could cause any issue if not managed, but there's a easy report to run. And so on top of that, and so that at this point, don't anticipate any issues or anything with our budget going forward.
You are still anticipating a small surplus?
With that supplemental grant, that's exact in managing that throughout the year. I want to not knowing how the current 2024 budget request is going to turn out. Wanted to hang on to a few some of that money at the end, roughly 4,000 to 5,000, to be able to have a few hours heading into next fiscal year, if dependent upon how the budget cycle goes. If the 2024 budget goes forward as presented, that would change how I would use that $4,000 to $5,000.
Okay.
With it immediately trying to use it this year is what I would do to be able to get more hours rather than 2 days a week, to try to bump it up to maybe 2.5.
Okay. Questions for Greg on finances for 2023? Can you stay with us for the budget?
Yeah, absolutely.
Okay.
Yeah, I forgot another thing. They know I'm going to be arriving late to that, so yeah.
Without objection, given Greg's other responsibilities, could we move up the budget, the 2024 budget proposal for veteran services? Any objection? All right, let's do it.
I appreciate that. Not looking for all the accommodations, but I'll take them.
Get the accommodations.
Thank you. Let me move down to.
Can you share your screen, or who's going to do this?
I can probably share my screen if I don't see that I have that as an option. I'm just clicking on more.
Download it or go into the omnibus file. Yeah, because the cell references get lost.
Greg, I think I can get it for you.
Okay, I appreciate. Yeah, unless you can tell me what icon on here. It doesn't look like I have. Oh, let me just see if some magic can happen here.
Oh, it's got it. Otherwise, okay. Okay.
Did it miraculously show up?
Yes.
Yep, it just needs to be a tiny bit, well, I mean, doesn't need to be a tiny bit bigger. We have it in front of us. I assume we do.
How about this?
Yep,
Mhm.
yep, perfect.
If you hit the right button, good things happen.
Yep, hit the right buttons.
So I'll get a little bit more detail for you regarding our 2024 request. So typically our budget, we have a number of static areas, as I would identify the 3 cost centers. I'll speak to the Veterans Relief Cost Center first, and I'm just giving an overview right now rather than digging into each. Is the Veterans Relief is static at $13,146 as far as the budgeted amount. And with the way that the budget gets implanted in here, it goes ahead and identifies the, excuse me here. Sorry for moving this around. So it shows as 11 as the proposed budget, the $11,646. However, there's some revenue that is identified in that reducing the proposed budget. The expenses should be $13,146 dollars. And honestly, I think there might be a couple lines missing on that. And because when I look at the 6,800, that does not add up to 13,146.
It does add up to 11,646 though. That's the total that
Yeah,
we're at.
okay. If that's what's in there, then that's what is in there. It's typically 13,146, and that would be my error for not keeping that static. I'll look in the budget folder afterwards, and that's go forward with that request. In looking at the other cost center that is static is the service officer grant. Apologize, I'm having some right here. So, the service officer grant is $11,000 based, and that's based upon population. And also, if you have a full-time service officer, that's one criteria, and then the other criteria is based upon population. That dictates the amount of the grant. Based upon Dunn County's population, we're eligible for $11,000. We budget that out with the anticipated approval of that. We have went 20 plus years in receipt of that grant. The last 12 years under my tenure, we've received that grant and satisfied all the reporting requirements. So I don't see that any of that is at risk.
No,
And if I'm going to move back up, I apologize for scrolling a lot because I don't have multiple screens. So I'll focus in now on the 1520 1010 cost center that captures our operating funds, and that is really the heavy hit to the tax levy, as well as the fund balance. And so within this, you're going to see that a rather significant change. You see it down to the bottom line up front. A significant change from what you typically see from the budget requests that I've made through the years. What I've requested is to the part-time position that I have, to move that part-time position, which based upon last year's budget cycle requested one day a week for the year. This budget request increases that 1 day to three days. And the reason for the 3 days is you start to trend up more than the 3 days. It comes down to a real heavy increase in funds that we would need because of additional benefits. So trying to nest these extra hours in appropriately to be able to give our office the staff coverage and the additional hours that I believe, based upon my assessment, to function at the level it needs right now, based upon the number of requests and that we're getting from veterans. And the full justification and rationale really comes into the workload over the past few years, and then with the approval by Congress for that PACT Act, that's where that justification from my assessment comes from. And given just a historical glimpse as well, historically, right before I took over in the office about 12 years ago, there was a full-time administrative person in the office. A few years, I think, before I'd taken over. I was over 12 years ago. So that had been a piece of the office historically. And so from my assessment, I don't think it's a large ask to request to have some additional hours in the office for a number of reasons. The workload coverage is one, and to identify some of those additional special duties that can put the claims related focus, to be able to do even more for some veterans, where some of the more of the administrative tasks can be handled by the part-time person. Is there any questions regarding that information I provided?
So as you're looking at your budget, you're seeing an increase in attendance hours, which would be the hours for that position to handle the additional demands from the PACT Act. And ultimately, that's at the bottom line, it's a 13% budget increase. Probably more than a 13% increase in clients served over the last year or so. Anything else on that, Greg, or any other questions?
Just the
Patients?
Yeah, and included in that overall percent of an increase, it does include some of those items that really with fringe benefits that are outside of
Sure.
my management control. That also includes that. I think there's grid increase of 4%, I think, for cost of living. And it's been a while since I looked at that. I just use those numbers are fed to me.
Sure.
So don't have the management piece over that. So all of that increase is not nested in just that position.
No,
To be fair
no,
to
right. And those things are sort of beyond manager's control. So questions? Supervisor Steen?
Yeah, if I'm understanding this correctly, we go from 246, 477 to 279, 525, money wise. Is that correct?
Right.
Okay, which is
13.41.
okay. Yeah. Thank you.
Supervisor Hagan?
Thank you. I kind of have something tangential, that
No.
word.
Tangential.
I'll take that word.
Okay.
But sort of related to, so the attendance hours will be for your current part-time employee to get the extra hours into the office. We get that. Is there any benefit for your office to get a volunteer, like an unpaid volunteer, a couple of other people in to help your office, or would that just not exactly have the capacity or the time to train additional people in the office at that time?
And there are volunteers in the office.
Yeah, I can speak to that. I think that, yeah, that's an appropriate question, certainly. We use interns and volunteers throughout a lot. And actually the part-time person that we have was a work study student that because of skill set, that's where we work to try to hire on. So currently we have two volunteers, one Lamont Minen that works Monday mornings, roughly 9 to 12:30, cleans and organizes medical equipment, repairs them. And then we also have James Stewart, who comes in Monday afternoons, Wednesdays, either morning or afternoon, and Fridays at times. The reason that I moved to having a part-time person is I have a lot more control over the activities and the schedule of a part-time person and outputs. And so that was the rationale behind that, because, and the other thing is there's levels of confidentiality, need to know basis, access to systems is the other reason. The attendance hours are a combination of one full-time and one part-time.
Plus
Does that answer your question?
Yeah, and then on top of giving the extra hours, that person already has the experience with the office and everything like that too, versus just adding additional people in to help. So yeah, I completely get that, and I think that's great.
Yeah, thank you. Any additional
Anything
questions
else
for me?
that you want to point out? Greg, would you go up to the top and just run everybody by the overall revenues, expenditures, that one? Yep, thank you.
Yeah. yeah, you can, really the emphasis, you can see the increase in the comparison from the 2023 to 2024. And again, the bottom line is increasing. Things would again be static in the office as is based upon 2023, but the real highlight and the change coming forward from me is the increase in those hours for you guys to take into consideration.
Right. Anything else? Questions, observations, any points that you want to make? All right, since I'm sort of moving the agenda around and since we can let Greg go, let's go ahead and act on the VSO 2024 budget request. Supervisor Steen.
I move that we approve it as presented.
Mr. Lamb seconds. Any further discussion? If not, all in favor of approving the proposed 2024 VSO budget signify by saying aye.
I,
Any opposed? We approve this budget request and off it goes to the county board. Thank you, Greg.
Yeah, thank you very much for the flexibility. Appreciate it.
Thank you for joining us, and we're sorry that you missed the cupcakes.
So you guys have a good night. Thank you very much.
You too. You
Thanks,
too.
Greg.
All right, have to get organized here. All right, Department of Public Health staff report. I think we'll stick to the agenda for now. Sorry, Cassie. Okay.
All right, so in your packet, you guys have a traditional update. It is a little bit light. Sorry, things are moving around on my screen. I apologize. So just kind of sharing with you guys some of the program updates. Do want to share that with our communicable disease update, we are working with the state on a case involving a little associated with acute flaccid myelitis. So that is our first Dunn County case. And so hopefully we'll have good news to share at the next board meeting. But that is something that we're watching very closely.
What
So
is-
it is, they're not really sure if it's causal or correlated to a viral issue, but there is an impact to especially small children where they actually lose function in their muscles. And so this little is intubated and not breathing on their own.
Oh, dear.
And so it's something that the state and the national folks have been watching for probably the last 2 to 3 years. And they know more about it. I don't know that they know 100% what's causative. And at this point, it's supportive care until the little moves through that.
Oh,
So that is pretty significant.
yeah.
And then, so that's not in your update. That's not written. We just got word from the state this week actually on that particular case. So other items in here, giving you guys continued updates on our outreach following our strategic plan. So that's continuing to move forward. Also an update on our community health needs assessment. Again, if you've not taken it, please do. And we are moving through, we have some pretty good representation from the classic folks that respond. And so we are targeting additional outreach with specifically 18 to 24-year-olds. And then we also just did some outreach at the jail. And so we've collected some additional surveys through that targeted outreach, spent some time at the farmers markets, really engaging with some of our Hmong farmers to make sure that we're representative of their voice as well. Also, you guys see a picture of what it looks like to do a lead risk assessment in someone's home. So I had shared with you that we had a little that had a very significant elevated blood lead. And so this is what it looks like when our team goes out with support of the state to look at where that child may be being exposed to lead. And so that is a little play space next to a garage barn that has known lead. Luckily, that soil did not have a high lead, very high lead in the known garage barn. And so continuing to work with the family and provider, looking to connect them with grant funding through the federal, some federal grant dollars through the state to help replace some of those high risk surfaces like windows at no cost to the homeowner, which is fantastic. So continuing to work there. Any questions on that very kind of small update? And then I guess in the packet itself, you guys see that you have a couple things in there. You have your normal laboratory surveillance report looking at both COVID and influenza. We are starting to see a small uptick in RSV, which is unfortunate locally. And so it looks like it might be another early year for that as well.
Excuse me, KT. Supervisor Steen has a question.
Oh, I'm sorry.
Yes, KT, going back to your environmental health thing and the water initiative. And this is a question that maybe Polly could answer, or maybe you can answer. Do schools test their water? Now, I know our village tests our water every week. We have, I think, 6 sites that we test every week, but are you aware, or are you doing any stuff with schools or anything?
So this is a targeted, so the lead and water program for childcare is targeted. And in the past, I think the year before I got here, there was one targeted for schools. And so there was kind of a top to bottom. And it's really that last couple feet, because they're coming from a municipal water system where it is tested, and it's within the piping, within the fixtures before it gets to kiddos. And so so the answer is yes, they're tested at the municipal level, and there are routine, maybe not as often, obviously, cycles where we're testing that last couple feet.
Thank you.
I'm sorry. So in your packet, you have a couple things that I wanted to lift up for you. One is acknowledgement that the state is also looking at their fees to be more risk-based. And so I just wanted to foreshadow that for you. Also gave you guys an update for our public health emergency preparedness consortium. So that's another annual report that you guys saw. We are part of that consortium. I'm their current chair. And we do really pool resources when it comes to emergencies, since those, as we all know, don't stop at geographic borders. So those are a couple things that I wanted to lift up in addition out of the packet. Any questions?
Any questions for KT? All right, go ahead. I'm sorry, Dr. Hall. I was not paying attention.
So I just wanted to make a comment, and I don't think you were going to talk about it otherwise, but the big report on the GPR funding, are you going to talk about that, or?
I wasn't,
which is great, but I just need to make a comment, and I don't know how to put this professionally. Outrage is kind of too strong a word, but for such a small dollar amount that was parsed out to health departments to then ask health departments to give you all this data on how you used this fund and how this couple of $1,000s changed your and what you learned from it, and then that we paid someone at the state to spend I don't know how many hours putting together this report overall, and then based on the size of the jurisdictions, and I just livid would be a bit too strong, but it makes me wonder. I mean, I understand we want to make sure that the money that we're spending at the state level, and it's very exciting that money is coming from the state level to fund something that is very important statewide, and that we need a lot of coordination, and we need to make sure that everybody has the resources that they need. But for such a paltry grant amount to be doing all of this brouhaha about it, I understand wanting to make sure that we're stewarding our resources, but I was not happy with how much time and effort went into hemming and hawing over whether it was helpful and how it was helpful. So
thank you for pointing that out. I agree with you.
To express that. Thank you for listening.
So thank you for sharing that. I did give that to you guys in your packet, so you can recognize that while we are underfunded as a state in Wisconsin from state GPR. We do want to show that the money that comes to us is being used in an appropriate manner and hopefully make the case that we should have more. And so I guess that maybe talks a little bit about the Public Health Foundational Capability Cost Assessment that the whole department is doing right now. We are also trying to make the same case by really in granular detail, spending way more hours than I'd like to show how we fund the work that we do and how that work aligns with what the community wants us to work on. So those gaps in services and direct care versus foundational public health services, which is really policy systems and environment work. We don't have money for that. And so again, showing that the need is significant and the funding is insufficient is hopefully going to be able to pave the way to have those talking points with our legislatures.
Something to consider as we work on our legislative ask next month. So keep that in mind, committee. And I would suggest if you haven't read this data summary, you should. Go ahead, KT.
Okay, so with that, I wanted to take you guys through our financials for year to date. You guys all have that in the packet. Item 8B. Like I shared, we are super grateful that Jane is back at work. We did put this together kind of in haste right as she was coming back, but I do believe that at this moment we're showing, again, accounting for birth to 3 and not having the same kind of ARPA carry forward, about 28,000 to the good for this year to date. Any questions on that?
Any questions on the 2023 budget summary? All right.
Okay, thank you.
All right, moving ahead. Human Services.
All right. Well, part of my report was Casey, and so she took up part of the time for this. And then the second half of my report is the document that you received. And I know it's an extensive meeting tonight, so I won't go through the details in there. I wanted to add just a couple things to that. First of all, our department was notified this week that a grant that we submitted, and Jenna Gunter and Carrie Anderson from our Family and Children's Unit applied for a Youth Innovations Grant, and they received that this week. What they applied for was $100,000 grant to help our unit, and they didn't put the amount in the award letter, but we're hoping that that's what we got because that's what we applied for. So to help with services there. So great news and congratulations and thanks for the great work on that team. Also, in my director's report, you would have seen that the RWC also was audited, and the OIG audit is like a huge deal. That is a major audit, and to only have $2,700 in corrections with that is unheard of with that kind of audit. And they have already submitted the documents. And what I went in a meeting that I had on Monday with them is like there was 50 pounds of paper that was sent to them for this audit. And for this, and so some of the stuff like that they said wasn't in there. I think they just didn't simply see because there was 50 pounds of paper. And so some of it was just pointing out, it was in here and here's where you find it kind of things. So, and, a couple other things were, maybe not in there, but we have the documentation to submit. So hopefully that would reduce the $2,700. But even if it doesn't, for a 9-county consortium to only have that tells you the great work that's happening there. So just positive with that. I'm really appreciative of that. So that's what I have for my report. Do you have any questions? Yeah, Dr. Hall.
So just a comment on congratulations on reducing that wait list or those wait times that you talked about. That's amazing. That's wonderful. What a great way to serve our citizens. So nice work. Well done.
Wonderful. Thank you. And that's Casey again. So thank you. And her team, of course. Yeah. Any other questions?
Any questions on the department report?
Next is the financial report.
Financial reports.
Financial report. And first of all, I want to introduce Jerry Rumpel. She is here with us. And Jerry, how long have you been now with Dunn County in the finance department?
In the finance department, just a little over a year.
Yep.
So, and previous to that, I did payroll for 2 years.
So to start in finance a little bit over a year ago and to take on the human services department. Like,
I'm still learning.
wow, wow.
Trust me.
Still very pretty.
Because as you've seen from our budget report, that's a lot. And so Jerry has just done a marvelous job. I really appreciate her. And the report that summary report that we go through at this portion of the report here, the board meeting here is Jerry. She puts all of this together, takes all the numbers and budgets and synthesizes it in this nice report. So when you see this, think of Jerry and the work that she's put into that. Very appreciative of her. So the report that you have in front of you is through the end of July. So we have a half a year of information or expenses and revenue in there. And at this point, we're projected to have a surplus of $594,724, which is excellent. We're at actually $243,029. But when we look at things, we do a projection till the end of the year, as you know. So if there's something that's a one-time expense, we don't times it times 12, we, kind of look at those projections in that. And so that's exciting news for us that we're sitting there with that amount, hopefully by the end of the year.
Supervisor Steen
A-
loves the bottom line.
Am I safe in saying then that the 594,724 is where we think we're gonna be? And instead of Sarah, Jerry's saying that, is that correct?
Correct.
So when I go out in the public, I can blame Jerry then, is that right?
Yes.
Yeah, you can blame Jerry.
It's all my fault.
Blame
It's
Jerry
on
for
me.
all the great work she does. Yeah,
Thank you for your work.
yeah.
Thank
yeah,
you.
Yeah, it's been a joy working with her, so.
That's great. Welcome
Yep.
aboard. and
Yeah.
Thanks for all their help. Anything else for Paula?
mm-mm.
All right. Off we go to budget. 2024 budgets.
Financial report. Department monthly. Do we have the vouchers?
We haven't done the vouchers yet. I thought,
Review.
yeah, we can do that. I thought I would go to the budgets.
Yeah,
first.
sorry.
And I don't know who wants, who wants to go first. Public health or human services.
I just want to make sure that, so we're moving to 10, right?
Yes,
And so we're going to go to the budget and
We-
come back to vouchers.
yes,
Okay.
yes.
Okay.
Sorry, because I just am moving everything around today.
I just want to make sure that I can follow along at home. All right, so let me pull open my budget and then I'll share my screen. I know I can do this. All right. So hopefully you guys are seeing my screen.
Yep,
Okay.
little bigger.
Yes, absolutely. All right, so I do want to share that I apologize, but there have been changes since when I uploaded to today that I haven't really wrapped my heads around. So I just want to be straightforward around that. So right now I am submitting a budget that is over. And so I just want to own that. I do want to share kind of where I think those things are coming from. And so we can talk a little bit about that. About 84% of my budget is salary and fringe. So every time we have a cost of living increase, both in 23 and 24, that definitely impacts my budget. So that's really important for you guys to have that awareness, not just in the summary, but then also in the roll up. My grants, however, have not changed. They stay flat or have gone down. The one change that you see in the budget adjustment in the packet today is WIC. We have had an increase to reflect the increase in caseload. And so for that, I am grateful. We have really changed our projections on our revenues. And so you guys can see that in our program generated revenues we have been much more conservative. We thought we would be back to pre-COVID in both our construction and our use of our reproductive health clinic, and that is not the case. And so we're really looking at either flat changes from 2022 or very minimal increases based on known revenue that's coming in. There's no over projecting on our revenues. I hope that we will get back to where we're at, but I can't in good faith bring that to you. Overall, if you look at our expenses, our salaries have gone down, and that's because we have some limited term employees that were grant funded that are no longer going to be employed in 2024. And then our overall expenses are also coming down. We're really trying to tighten that belt a bit. I will follow what we need to do. I'd like to go back to finance and double check. Again, like I said, that there are some changes that I was not aware of between when I submitted that on Thursday. There was an update to the macros on Friday. And so this is slightly different than what I anticipated showing you. But I do want to point out that I do have a fairly large 5-year grant that's not accounted for in this. So the public health infrastructure grant, you guys will see that on the grants page. I can pull that up. We had hoped to use that $30,000 a year for 5 years. And if directed, we'll put more of that into this year's budget. And so that's, again, a grant that we have a contract for. It's a 5-year grant, and we were trying to kind of hold some of that back. So questions? I know I just threw a lot at you.
So what is the bottom line on the adjustment that we don't have in front of us?
Say that again.
What you have suggested that there's some changes from the,
Yeah.
so is there a bottom line
It was
difference?
a change in about 50 grand. So when I submitted it, I was showing an overage asking for 65,000, and right now we're at 115.
Okay, we do have 115.
Yep.
That's what it shows.
Yep. I do see that.
Okay.
So, and I appreciate that. I think that Excel and I are not as good of friends as we should be. I do understand that there were some changes to the macros, and there is a difference in when I submitted it on Thursday and what you're seeing now. And so I apologize. I do want to go back and talk to finance about and really understand that a little bit better.
So, this will be revised. So I'm sort of thinking about what we do here about approving a budget that is in flux.
That's the current.
This is the current.
Mhm.
Yes. So you're approving round 1, and really you're approving the concepts, the dollars that
Sure.
are gonna move and shift
Sure.
over the next. So if there's anything specific or in detail with KT's budget that you think is out of whack, then you could make changes to that. Otherwise, the numbers will continue to move and shift over the next.
All right. Okay.
But you're approving what you.
We are approving version 1. Okay. All right. Okay. Supervisor Steen.
Yeah, KT, is there any personnel additions involved here?
So there aren't any. It's actually a reduction in staffing from this year to next because of those changes in limited term grant limited personnel. I have somebody that is able to retire and has been for quite some time, but that's their choice, not my choice to know when they're ready. I don't anticipate any changes, but if there is a need, that's something that if you guys direct me to, I'll take under consideration, work with finance.
Question is, are there any unfilled jobs that is budgeted for that? Okay, thank you.
Yeah, Dr. Hall.
KT, can you speak to looking at in public health administration salaries and wages, we're looking at about a 46% increase over the 2023 budget. Could you speak to that and help me understand where that's coming from?
Sure. All right, so scrolling up. So public health admin, and then that's our revenue. Let me go down to expenses. For a 46%. I will have to dig into that a little bit more. What has happened is that when people are hired, they're put into public health admin, and then we take them out and as a budget adjustment, and we put them someplace where they belong. So I would guess, without digging into it deeper, that that's probably what we're looking at. So for example, when we hired our reproductive health nurse, we are still waiting on that budget adjustment to change her revenue, her cost center, back to reproductive health. So I guess that's where that's at, but I will absolutely dig deeper and come back to you on that.
Yeah, there was a fairly significant increase in that category in lieu of fringe as well.
Mm-hmm.
Yeah, figured that's what that was. I had a question, public health admin, on contractual consulting services, and I don't have so much a question about the amount, but the comment.
Oh,
I didn't understand it.
sure. And I
And that
apologize.
is on page 2 of 4,
So
up at the top.
right here. And so these are internal notes. I think we need to be more mindful of what we're putting in, what's going to be
I
shared.
know
with you.
sometimes the notes are a little confusing.
Sure. So with our contractual services, one of the things we tried to do is we have an electronic medical record system called Nightingale Notes. So that's the NN. And so making sure that they're put into the cost center that the user resides in. So I have a Nightingale Notes. And so instead of it being picked up by grant dollars, which is where we were paying for it last year, it's now going to the appropriate cost center
Got it.
as we have it. We have a medical advisor. And so we pay Dr. Strong a certain amount. And Stericycle, so to get rid of our medical waste. And that's where that's coming from. So the very significant increase is due to Nightingale Notes.
Okay. And then there's a note about $10,100 KT.
Yep. So me, our public health nurse Sheila, our public health nurse Deb, coming back into this home
Got
cost
it.
center.
All right. All right. Thank you for that. Any other questions or observations? Anything else you want to point out, KT? I'm sorry, Supervisor Hagan.
That's right. Just one thing, going back to the sorry about, I can't remember the phrase, like grant limited staff members that you had. I know
LTE.
LTE,
Limited
your
term. Mhm.
your LTE staff members. I know a bunch of them were through grant programs that were specifically meant for a limited amount of time.
Sure.
With those positions expiring at the end of this year, not going into next year, are there any of the services that they have been providing that are those services carrying forward? So, or are all of those ending as well? So no additional service
Sure.
is being put
So
on the,
just to be really straightforward, our limited term employees grant limited term employees. We had a NACHO grant, so National Association of City County Health Officers, that funded an individual to help us get more, to catch up with emergency preparedness. And so she has finished her term with us. We have a brand new FEP, or Public Health Emergency Plan. And so we won't have her to do that work, but then we'll just have to maintain it instead of creating from whole cloth. And then of course, our contact tracers. So as of this week, we have stopped making phone calls to people that have tested positive. We continue to notify everybody who has tested positive with a letter, and then we continue to follow up on outbreaks. So if they're in skilled nursing facilities or a workplace, we'll do some follow-up. But we've taken that from a limited term employee paid for with ARPA dollars, which is our largest pot of money right now associated with COVID. And we're not carrying that forward. Is that helpful?
yeah, I just want to make sure that the services were specifically ending, finishing up, tying up all loose ends, and nothing was carrying over and adding more burden to the department that doesn't have the staff members to
I
take
would,
care of it.
I would love to promise you that we will no longer have a COVID burn-in, but I cannot do that. I do know that we are changing how we do follow-up for COVID.
All right, thank you.
Okay, anything else? Anything else, Katie, that you want to point out? All right, are you ready to take action on the public health budget request? All right, I will need a motion to approve the 2024 proposed budget. Mr. Lamb,
Also move.
is there a second?
A second.
Dr. Hall seconds. Any further discussion? If not, all in favor signify by saying aye.
I,
Any opposed? 2024 budget is approved and will move forward. Thank you, KT. And now we are at Human Services. And you take it, or Jerry. Microphone, please.
Thank you.
Thank you.
To help not flipping back and forth between reports, Jerry and I talked about having her run through the big budget sheet document. And then I will be running through the document that you have in front of you, hard copy tonight, the summary. So we're gonna start off with the bottom line summary here with this one. Thank you, Jerry, for making it bigger. So unfortunately, we are coming in with a request for additional tax levy in the budget for 2024. And there's several reasons for that that I'll get down into as we move forward ahead. But looking at right now, we're in the AMSO, are we, or where are we at?
Oh, we're just on a summary
Oh,
page.
okay,
We can go to Amazon.
okay. All right. So in the AMSO area, which I remind you is agency management support and overhead. So these are positions that help the entire department. So example, my position, some of our support staff, part of Becky's position, those kinds of things are part of that AMSO area. And then they get billed out to all of the department programs. So depending on how many staff are in each program, they're kind of, or that there's so much of my salary that goes to each program, for example, of that. So then it's spread out across there. So in that area, we have 5.38 FTEs. We have revenues coming in of $251,200. And then our expenses are the 1,339,420. So with that, we need tax levy to help support that. And that's your 1 million there, 88,220. So if there's any areas you want to look at underneath that AMSO overhead, I'm certainly, or Jerry and I are certainly welcome to look at any questions.
Anybody want to look at administrative costs? All right,
Also,
go ahead.
also you see a little note in there that says there's 250,000 in this area as a placeholder. What happens is that I think it's November, we can no longer do budget adjustments.
Right.
And so there's this placeholder in there. If something comes in, a grant or one of those things that we have to be able to do that, that placeholder is there for that. So.
And there's also an additional placeholder for the expense side of that too, so it
Sure.
drops to zero.
Right.
Right, yep. Any questions on AMSO? Okay, then the behavioral health services, which is the CCS services. There we have revenues of $1,849,179 and the expenses of $1,920,148, which is tax levy of $70,969. Now, this is my understanding, never happened before to have tax levy in the CCS program. But what I have been talking about now for a couple months is that because of having some new staff in that area, that we're not able to bill part of their time underneath the billable portion of the program, and it needs to go into what we call WIMCR. And we don't get reimbursed from WIMCR till the following year. So the 70,000 in tax levy for 2024 will come back to us in 2025. But we have to have the money in 2024 to pay their wages, right? So it does all balance out in the end, but that's, this year we're having that struggle with that from having the new staff and during that training period and such. So Jerry's got CCS up. Is there any questions or areas you want to specifically look in that section? We're good?
All right.
Okay. Behavioral Health Crisis Program. This program has 369,347 in revenue. And then in expenses of $603,060 with a tax levy of 233,713. This is not a fully funded program. This program, again, to remind you, is that immediate response when somebody's in crisis. We either get a direct walk-in call during business hours or after hours. Northwest Connections then assists, and we get that report the next day and we follow up with them. There was a suicide attempt. There was concerns regarding a potential suicidal thoughts, etc. Contact, and then we follow up the next day. So the intent of this program is to prevent hospitalizations and to immediately get those services in there for people following up in the next day or so. So because of that program, we do get some funding for that program, but it is not it's not fully sufficient. So we have tax levy in there. Any questions on that area that you want us to specifically dive in, Dr. Hall?
Thank you. So I'm looking, I don't know exactly where you are. So I'm looking at the document that I have and I'm seeing that I'm looking at the difference between 2023 and 2024 proposed. And I'm looking at salaries and wages and attendance hours. And so in 2023 for salaries and wages, we had 1032,368. And for 2024 for salaries and wages, we've got 520 and change. And then we have attendance hours. So it's just, we're kind of paying providers differently.
Right.
In different categories. But there's also, so overall, we're maybe about $300,000 higher than previous in terms of what we're paying people in terms of wages and attendance hours. And I see that 2 full-time positions were added in 2023. And is that what that is accounting for?
So I forgot that point. Thank you so
Okay.
much for bringing that up and catching that. We have made the decision that we are changing where our adult protection services are located within our department. And they're currently in the ADRC. And we learned that we're able to do some billing initially of APS cases that would also be crisis. So people that maybe are older persons that have mental health issues can then, and the APS workers go out or have some contact with them, we can bill crisis underneath that. So there's a teeny bit of billing. We're talking maybe 10% is what we're estimating. We won't know until we start doing this. So very, very small amount of revenue with that. But in addition to that, we also have so many more cases because they're complex working together. And so we decided to move that unit into the crisis program. And so they were previously being paid for mostly out of tax levy and a little bit of grant in ADRC. Now it's in crisis. Does that make sense? Yeah, it's just we shifted that. Thank you for that point though.
And we did talk a little bit about that caseload increase last month.
Yeah. And I'm gonna, there's also.
We have another one of these.
Sure. Did I not give you one, Dr. Who? I'm so sorry. I'm so sorry. Anybody else missing one? In addition, there's one new position request, and I'll talk about that at the end in that section as well. Yep. Anything else underneath crisis?
Go ahead.
Okay. Community support program, and that is with our persistently mentally ill persons in our community, and that program is works to reduce placement in institutions. So our Mendota, Winnebago type placements. And so we are looking at revenues there of 349, 424, and expenses of 602, 569 with the tax levy of 253, 145. That program is not self-sufficient. We do get some funding for it, but it certainly lies heavily on tax levy. If you look at the cost of a year in an institution, this, where this program is, it certainly is worth the tax levy we're putting in there compared to what we would have to pay an institution, and not to mention the quality of life of people. So certainly that. So any questions that you want us to, Jerry, to scroll to underneath the category of CSP?
CSP.
Yes, Dr. Hall.
So again, as I'm looking at that other document, so lines 170 and 171, again, in the community support program, we're looking at about $90,000 more in terms of salary and attendance hours from over 2023. So just kind of helping me to understand, where are we adding people? Why are we adding people? Just so that I can be responsible in terms of thinking about these things. Not that the need doesn't exist, because I know it does.
Right. And some of it is an automatic because we're projecting cost of living increases and step increases and that.
Sure.
So there's a piece of that. There's
Okay.
also a tiny piece because we filled the behavior health manager position. We created another one of those positions because of the number of CCS workers, and we had to add that on. This year, what we then did for 2024 is the person that was currently doing CCS was a half-time CCS supervisor. So we needed to then take her and shift her into some of the other program areas, and CSP was one of them that we shifted part of her work duties to that area because there was a need for that. So it was just a shifting. It's not a new person, but a little bit of shifting of where those dollars went to, or where the program is.
Thank you.
Mhm. Any
Okay,
other
moving on.
questions? Any other questions? Family and Children's Services, you're looking at revenues of 1,837,938. And expenses of 3,802,816 with county levy of 1,964,878. So no new positions in this area. We had to look at our out of home placements and the services that we're providing. There were some increases in services that we needed. Our out of home placement numbers are higher, although they're, like I said, a couple months ago, we're using foster care and treatment foster care and relatives, but we're having a lot more number of families. And so we're having to increase the services like mentoring services, parenting services, therapy services, in addition to like evaluations and those kinds of things. So it's really looking at that service area to try to keep kids out of care or to get them home as soon as possible. So that's some of the areas that you're seeing there, along with, there's 19.98 people in that unit. So when you look at the wages and increasing that by the COLA and grades and those things, you have that in addition with those 20 people. Any questions or areas you want me to have Jerry pull up?
Anything on
there?
Family Children's Services? Okay.
Okay. Next one is economic support. So we have revenues of 924,409. We have expenses of 1,155,608, which is tax levy of 231,199. And so this program has a match that we have to pay for the consortium, to be able to be in it and be able to provide the services. And that is what that is all about. along with the increase in wages and benefits there. Any questions or areas that you want us to pull there?
I guess not. Dr. Hall, did you have a question? Okay.
I love it that you read this so closely. I love it. The ADRC is next. Now, remember, the ADRC is had a removal of the APS program. So you're going to see here, it should be less than last year. So revenues of 1.8 million, expenses of 2.145 million, which is a county tax levy of 319,246. So for that program to only have that amount of tax levy is pretty amazing, I think. So when you're looking at almost 14 staff and the work that's going on there to support. Any questions in there? Okay, children's long-term support waivers, what Casey talked about tonight. We do have a required county levy maintenance of effort, which is 54,000. So that's about half of the tax levy that you're seeing there, which the revenue is 904 and expenses 1.17 million. And so then the tax levy of 112,085. So if you're looking at about half of that is being that maintenance of effort in that program. So questions on CLTS? Yeah. Mhm.
So again, comparing to 2023, overall salaries, wages, and attendance hours are higher.
Yes.
And
Mhm.
so when I think about too, and I don't know what the full county board meetings are like, right? But when we're asking for significant increases in levy, and then thinking about, okay, how much of this are we adding new positions? If so, why? And how much of this are those cost of living increases and grade increases and things that are outside of our control versus how many things are needed adding of positions due to increased demand for services? That might be very helpful in terms of getting county approval, I would think.
Mhm. So there is no new positions that we're requesting in 2024 for this. We did have a couple positions added in 2023. The service facilitation time, which is for the positions, is funded by the program. Like I said, it's that maintenance of effort, and then you have about $50,000 in service provision, that we're paying for. So with
Thank you.
that, so yeah, but good point, Dr. Hull. Any others? Okay, birth to 3. Our revenue is 308,000 and our expenses is 646,000. Which is county tax levy of 338,191. We have to serve every child that's eligible in this program. And we do everything we can to bill. We receive an allocation from the state for this program, but it's certainly not sufficient. We've talked about this. It's been on the legislative agenda that we would certainly like more. We've had higher cases numbers because of COVID and the outcomes of that. And needing to address those services or service needs. So there is no increase in staff other than the money from public health for this grant, but that's money in, money out because of that great gift. So besides that, that's where that program is at. So any questions on that?
And maybe just for perspective, you could go back up to the summary.
Yes.
Yeah. This might help to respond to Dr. Hall's question. So essentially, we are looking at a balanced budget.
With increased levy.
With increased
With
levy.
increased levy, correct?
Yes. Yes.
Correct.
Which we have to get approval for from the county
Correct.
board. Yes.
Right.
Wanna
You're very right. And
be armed. Forewarned is forearmed, right?
Supervisor Steve.
Yeah, Ms. Winter, I'm assuming that you worked in lockstep with Beata and Chris to arrive at this figure, and understanding that this is the first go around and that there'll be some adjustments made. And just, I guess, for the benefit of all the members of our committee, I think that the county is making a concerted effort in the last year or so to be proactive on including everybody, every department. And so we are working on lockstep to try to be as compatible with each other or as efficient as we can be as we address the budget. I think it'd be a fair statement.
Agreed.
So I guess we have the boss's blessing. So there we go.
Well, the boss certainly is aware of this. We were asked to bring in a budget that was not extravagant in any means, but what we needed. And, you know, there's certainly needs in other areas, but there's two areas that I feel strongly we need to add additional staff. And so, you know, with the levy request increase of 1,236,228, so that's significant, and I realize that. That's, you know, 100 people's salary increasing and all of that, so there's a huge chunk of that that's part of that. But there's also the two positions that I am requesting, and I wanted to show you, I have a short PowerPoint to show you the need of that. And we've been talking about this, but I prepared it for tonight and for next Wednesday evening's board meeting as well. So if you don't mind, stop sharing, Jerry. And I am going to share. Where did it go to? Hold on. Why didn't it come up? Oh, here it is. Here it is. Here we go. Let me get that, and I don't know how to get, it's not allowing me to get this. Oh yeah, okay. So we've been talking about APS, and Tracy came a couple
month.
times ago, last month, to talk about it. So I'm not going to spend a lot of time on this, but one of the positions is for a lead adult protection services worker. And what I have here is, you know, what that program is about. It serves people from 18 to 59, which is APS. And then we also have elder abuse, which is 60 and above. For persons that are either abused, alleged to be abused, neglected, are not able to take care of themselves, may need a guardianship, may need a protective placement in a facility, those types of things. So currently we have 2 full-time staff that are covering these cases. And then we have some of the ADRC staff doing a little bit of add-on, which are the protective placement reviews. Anytime somebody is in a protective placement, they have to have what's called a Watts review, which is an annual review every year to make sure the placement's still needed. It's a safe placement, all those kinds of things. And they have to write a report to the court. So those are the types of cases. You've seen this last month, we had a 43% increase in referred cases between 2017 and 2022. We've had a 48% increase in referred cases in the first 6 months of this year. And we know with the increase in the baby boomers, this is just going to keep increasing. So in addition, the cases have become so much more complex. There's not a simple case out there that's not even being heard of. It's really complex. There's co-occurring mental health, AODA, physical abuse factor or physical factors, all of those kinds of things. So it's not a simple one disease type issue. They're just really multiple. And so the length of time that we're involved in the cases, this is a mandated services and we're in need of an additional staff to help with that
Clearly.
number. So that's the one position. The second position is a mental health therapist clinician, and this is in our clinic. We are currently, we have 2 therapists in the clinic, but we are requesting that third clinician. There's 2 areas that we would really like to be able to address with this clinician. Number one, our CSP program and other areas of the department need additional clinical supervision. And so what that means is any one that is not licensed or a program that has to have a clinical supervisor as part of their requirement, those staff have to have supervision by a clinician. And so there's so many hours a week that they have to have this. And so because our case numbers keep going up and the complexity of the cases, we need more clinical supervision time. We just don't have enough. And because our current clinical supervisor is Wendy, who is the behavior health manager. So she's running all the other programs in that unit plus doing the clinical. It's just too much. And then in addition, we want to be able to serve the children and families in the family and children's unit to meet the needs of the families who are at risk. And we're hoping with having that comprehensive care of having child protection and probably CCS, CLTS, and then hopefully having a therapist that's all part of this wraparound team that we're able to prevent or reduce the placements or bring kids home sooner. Whoops, how did that happen? And then I just took some data from the youth risk behavior survey in Dunn County. So this is our data here. And as you can see, when you're looking at the students that answered the surveys from Menominee, Boyceville, and Colfax schools, we have children or youth that have had suicidal thoughts or behaviors. They have seriously considered. This isn't just like, oh yeah, I thought of it. This is seriously considered suicide. You know, we are looking at 9th grade 17%, 10th grade 14%, 11th grade 19%, and 12th grade 14%. And these are our kids right here in our community. We're not talking Milwaukee or whatever. And then we also have in that same survey, mental health concerns. So they self-reported that they have a mental health concern, like their own report of a diagnosis or something going on. And I mean, we're looking at, 47%, 62, 47, and 70% of the students that are self-reporting that. And so those are students that may not even be touching our system, but so that the kids and the families that we're working with are a great majority of these and just really needing to be able to have that clinical portion of that. So we want to provide the one-stop shop. We want us to provide the support for the staff who need the clinical supervision. And there's a partial revenue source for this position and we bill Medicaid, we bill private insurance, or if they have an ability to pay, we bill them too. So this is not a fully tax levy position like the adult protection one that there's little funding in adult protection. So that one is, really tax levy if you want to get down to it, but this one is partial. And that's that program or that position that we're requesting.
Any questions for Paula about the rationale for these positions, Dr. Hall?
Thank you. Not a question, but a comment. So thank you for that, because I think it's really important to tell the story in a way that the full county board can see how big the need is, right? So, I love that graph about, the aging population, the increasing numbers of adults that we've had to get involved with for APS, those types of trends over time, and then telling that story that, of course, if we meet the needs of these folks, and if we do a good job serving them, then that's alleviating pressure on, the police forces and all kinds of other, it's saving us other costs as well as improving the lives of our citizens and community members. So thank you for that. I
very
don't doubt that you could use 3 more behavioral health clinicians. That job description is pretty extensive. But so just kind of thinking about, because I mean, I don't know about you all, but whenever I've had to ask for a bigger budget, right, the stronger the justification can be and the more effectively you tell that story, the more likely you are to be successful.
Thank
So
you.
thank you.
Thank you. And one of the challenges, if it is approved, is to find one because there's a significant shortage
Yeah.
of clinicians. And
Clinicians.
so, that it will be a little bit of a struggle. I'm hoping that we'll be able to fill that, but that could be a concern as well.
So Paula and Jerry and just a second, and Becky, this is a monumental task. So thank you for doing it so well. Chris,
I think it can help you guys out with the summary. Paula hasn't seen this document, so. But it kind of goes to Dr. Hall's, make it bigger. Since she will not be a part of board
no, sure.
piece next week. So this is human services.
No.
Here on the left-hand side, this gives you the side-by-side comparison. The top boxes are the levy from last year. This is assuming levy same for this year because the gap is not yet determined to be filled by levy. It's a funding gap and we have to determine how to fill that. The revenues then side by side. So there's actually a $791,000 decrease in revenue, a $915,000 increase in salaries, and then a $471,000 decrease in expenses. But then you can see what those are comprised of. So the revenue decrease, the new positions come out to $218,000. The wages, it's based on a 4% wage increase. That's actually going to come down to 2%. So that number will come down. And then the operational decrease leaves you with that deficit of $1,236,000.
That's a beautiful graph. Thank you. Yeah, thank you.
Any questions about that?
Oops, sorry.
Enumeration, I could be your poster child on the group that served.
I might join you on that. All right. Any further questions on the human services budget? Well, we have our experts all here. All right, I need a motion to approve.
I move to approve.
Dr. Hall moves. Is there a second? Supervisor Robinson seconds. Any further discussion? If not, all in favor say aye.
Aye.
Any opposed? DHS budget request is going to move forward. Thank you all. I know it's a lot of work and thank you for bearing with us and thank you, Jerry and Paula and Becky and KT. This is a lot of work. Okay, we will, since I've been moving the agenda around, now we're going to go back up to 10A, which is approval of the DHS vouchers. Paid for July, again, our checkbook figure is $440,111.50. I need a motion to note review of the July vouchers.
I so
Dr.
move.
Hall, is there a second?
Second.
Supervisor Hagan seconds. Oh, Paula Rudy got it, won the war. All right. Ms. Rudy seconds. All in favor?
Aye.
Any opposed? Vouchers are noted. And we have 2 budget adjustments, a health department budget adjustment and a human services budget adjustment. Okay, public health, do you want to go first?
Sure. So what you guys have in your packet is, I think, a pretty good explanation. So in 23, when we created our 23 budget, we were going off of what we thought we were going to get in 22. We actually did not have our finalized numbers in 22, if you can imagine, when we created our 23 budget. So we just heard that so not I didn't bring it last month because we were waiting for Jane to be back in the office. We had our finalized number, and then we got some unexpected good news that we were actually going to get a one-time increase in addition to our finalized numbers. So that's what you're seeing in front of you, that full increase of, I think
$7,421.
thank you so much, $37,000 and some. So that's what you're looking at right now.
Okay. Any questions? I need a motion.
I move we approve.
Supervisor Steen moves approval of the budget adjustment. Mr. Lamb seconds. Any additional discussion? If not, all in favor signify by saying aye. Aye. Any opposed? Public health budget adjustment is approved, and a budget adjustment, another longie from Human Services.
So Jerry is also the creator of this. And so I think I can summarize it, and Jerry, you jump in if you have additional, but CCS and CLTS, we added staff this year in those areas. And we needed to be able to account for the Medicaid dollars that we will be bringing in from those staff. And so that's what this does in the budget. And we did receive a decrease in the family treatment court grant than what we expected in the budget by $8,248. And then we received a mini grant from the Mayo Clinic for $1,500. So that is what that is about. Any additions or questions?
Any questions on the budget adjustment? Again, I need a motion.
I move.
Dr. Hall moves approval.
I second.
Supervisor Hagan seconds. Any further discussion? If not, all in favor?
Aye.
Any opposed? All right, that is approved and moving forward. Unless anybody has any announcements? Questions, comments? We are adjourned.
Thank you.
Thank you, everybody.
you.